Hi, and thanks for joining me today. We're going to be looking at the topic of vocabulary for items in a first aid kit. So this could be particularly good if you are studying for your OET exam, or maybe you are a healthcare professional and you want to work in that environment in an English-speaking country and you just want to improve your knowledge of certain items. This is a pretty standard kit we're going to go through, so I hope you find it useful. Let's begin. Right, so in this part of the video we're going to start looking at our standard kit, okay? So to begin with, we have something here called a triangular bandage. Now I'm quite aware that you may not be able to see this, it's a little bit faint, so I will be putting some words up underneath as well. A triangular bandage is also known as a sling. So this is what you would put over somebody's arm and shoulder. You'd wrap it over to secure it, okay, if they've had maybe a sprain or an injury or a really big cut or laceration, or they may have even broken their arm, worst case scenario. So this is that product, okay? Then we have a couple of types of bandage. So the first one is called a conforming bandage, okay? A conforming bandage. It's slightly different to this, which is a crepe bandage, okay? They're a little bit different. A conforming bandage is what you would use for flexibility, maybe on someone's joint, like an ankle sprain, for example. It allows a little bit of movement. But a traditional crepe dressing, which is a little bit different in its fabric and its material, would actually be used maybe for areas where there is some swelling, and you could use it on legs and arms, okay? So there's different types of bandage. How do we talk about them? Well, we simply apply them, wrap them, and make sure that they're secured, okay? So we use these types of verbs quite a lot. What else do we have in this little kit bag? Of course, it does always come with a kind of a pamphlet instruction, and it should list what's in here as well. So this would be your reference point, okay? I'll put that over there. So the other items that we have in here would be a wound cleansing wipe, sometimes called a sterile dressing a sterile wipe, correction. So a wound cleansing wipe, a sterile wipe, or even an alcohol wipe, which would be used to clean the site. And the site could be ready for injection. Well, we're not going to look at injections today, but it would be used for site preparation for injection or to clean a wound, okay? So that's that. We also have in here something you might need to secure your bandage with is your tape. Sometimes it's called micropore tape. And this is a type of quite adhesive but also quite gentle to the skin tape to secure any type of dressing or bandage that you're using, okay? Right, so the other thing we have in here is an ice pack. Sometimes the opposite would be a heat pack, but this is an ice pack, and it's used for sprains and abrasions. So a sprain is a sort of mild injury to a part of a joint or a tendon, okay? And obviously an abrasion you could use this for as well. It could be quite soothing. How we would talk about this is you would break and shake, okay? Break and shake. So you'd rip it open, twist it to break it, shake it to activate it, and then you would have a nice cool pack, okay? We might say it would be very soothing is a word we would use if you are applying this to somebody's skin, okay? That's that one. The other thing that we have in here, these are sometimes called safety pins. Various sizes in here. The reason they're safe is because they shouldn't stick out. They have little caps on either end, so you can put them through a bandage, for example, or a sling, and it would be really safe. It wouldn't dig in or cause any trauma. Okay. We also have in here an eye pad dressing, sometimes called an eye patch. Of course, it's a oval shape, so it fits snugly. It's a word we would use over the eye area. You would also need a dressing to wrap around it to secure it, obviously. So that's an eye pad dressing, okay? And we also have in here some vinyl powder-free gloves. This is safety equipment. So if you are somewhere and it's a bit messy, somebody's obviously broken their skin, you know, there's a bit of blood, then you want some protection, so you'd wear these. I think that's quite a straightforward one, but we also have in this kit a pair of forceps, okay? Forceps. So these are plastic. They can sometimes be metal. Anything that looks like this in medicine is called a forceps, but it will have different names. We're not going into that today. However, this is something I might cover later on for more advanced surgical equipment in hospital settings. But all you need to know is that that's a forceps that we would use to clean up, extract, maybe any little bits of grit or stone or a foreign body, we sometimes call them, in a wound. And you can use this, okay? Or you could also get a splinter out of your thumb, toe with this, okay? So what's next? We also have a pod for irrigation. This is called a sterile wash pod. Of course, you should always check the date as well to make sure that it is in date. You would use this to irrigate the eye, but you could also use it to irrigate a wound and keep it nice and clean. But really, this one is specifically for an eye wash, okay? And we also have a few final items. We have our regular plasters here. So there is a big selection, an assortment of adhesive dressings. So adhesive means it will stick. So it will stick to the skin. Of course, you always have to check and make sure that a patient is okay with that. They don't have any allergies to plaster, okay? It's quite important. Variety of sizes in there. But on the other hand, we also have a low adherent dressing pad, which will always be in a square size, but there are also various sizes in the kit as well. So this doesn't stick. This would go over a wound. Then you might want to put some micropore tape around it if it's if it's going to cause more trauma, okay? So I think we have probably come to the end of our equipment today. I'm just checking through. Of course, this has all got to fit back in here and it probably won't go in as neatly as when I first bought it.
Thanks for watching. I hope you enjoyed it and found it helpful. Please join me next time when I will be looking at an OET speaking roleplay card and helping you with the format and some useful phrasing. See you then.